be here, and thank you for inviting me. There's quite a lot about me and my wife in the brochure, so I don't think I need to dwell on that further. But I thought I'd just say a couple of words really about why India. And I have a long-term interest, and I'm married to a Bengali. But also there has been an epidemic which I've seen really evolve. I first went to India actually long before I met my wife in 1990 to Mumbai, and at that stage I made an official visit to the Falkland Road, which is the red light district, and at that time less than 1% of the sex workers were infected with HIV, and we knew at that time, given the amount of STIs, sexually transmitted infections that there was going to be an inevitable increase, and it's been very sad to watch. The Minister of Health and the previous speakers have described some important background. The Minister mentioned the epidemiology in India, and West Bengal is fortunately at the moment a relatively low prevalence area, but that does mean that people visiting casual commercial sex workers are about 20% positive for HIV, so it's still a major problem. But there is, I suppose, a window of opportunity in that the more input we can put in now, then we can help to perhaps diminish the spread so rapidly. What are the reasons for the spread of HIV? Well, I think that they're well documented, and poverty, stigma, and particularly from my point of view, I'm a sexually transmitted disease physician primarily. Other sexually transmitted infections are very important in amplifying the spread of HIV, and this, along with lack of female empowerment, and is very important reasons for the spread. Now, the Toronto Kolkata Foundation has been addressing issues for some time, since it's founded, and I'm very pleased to see that it's keen to gear up the area in prevention as well as in treatment. And I was privileged to see what they did a couple of years ago, and at that time invited, along with my wife, to give a workshop in Baral village, which is the red light district. It was very, very interesting and eye-opening for me. Went into a room, there were 70 or 80 women with some children, no men at all. There were some men milling around outside, but although they'd been invited, they were either too embarrassed or didn't feel it appropriate for them to enter. And I don't speak any of the language, so I spoke more slowly than I'm speaking now, and I had my father-in-law, who's a businessman and nothing at all to do with the medical fraternity, translating my words. And my wife was also there giving a talk in Bengali, but she was shocked at her father's understanding of the vernacular, in which I had to use very obviously basic language in speaking to the women. However, from a slow start, they certainly became a lot more enthusiastic, asked lots of questions, and clearly this was a beginning or an addition to the education that was taking place. I was pleased to see that other education, such as the use of peer educators, were also being promoted, and that's very important. There's a lot more to be done there, and I think that the Minister talked about, and previous speaker again talked about treatment. Now, treatment is very important, and it is tragic that over 50% of the generic drugs that have been produced to treat HIV worldwide, but less than 10% of people are being treated in India. But that is beginning to take place. But I think what we need to do is attack on two fronts. We attack on treatment, but we also need to increase the prevention efforts. And from my own point of view, and this was discussed already extensively at the AIDS conference, the prevention and the treatment go hand in hand. And the areas that we need to look at in terms of prevention are to prevent transmission of HIV. Now, unfortunately, because of their situation, their poverty, their lack of assertiveness and ability to negotiate safer sex, it's quite difficult sometimes for them to be able to insist on condom use. The female condom, it can be used, but it's expensive, and also actually because it's visible, it requires agreement by the male partner. There are some other methods which are being looked into, which I hope will become available soon, and there's been studies presented at the conference on the acceptability of diaphragms, which are obviously a female-controlled method, and microbicides, which, although even if they're less effective than condoms, they could be some second-line defence, and could also be used with condoms when they are acceptable. There's also been a discussion by Bill Gates and others of oral prophylaxis with drugs which use one or two drugs which are used for treatment of HIV, but to be taken continuously to prevent transmission of HIV. Now, we're awaiting the studies that are being developed being at the moment, and we hope that some of those will prove possibly to be successful. However, in the meantime, what is important is to carry on these both fronts of what we can do now with current preventative measures, and also to improve treatment. And I think that will require knowing which people will benefit from treatment, and I think there's a necessity for further finance to improve the diagnostic tests, for example, doing tests for immunity, which will allow us to determine who will benefit most from treatment. I think that's most of what I want to say. I think that what is being done by the TCF is very helpful, and certain additional things such as the microfinance initiatives. There's actually a randomised trial presented at the conference in South Africa showing that this works in terms of getting people to reduce their risks of HIV acquisition. So I think all of these areas, they go together very well: general healthcare, treatment for HIV and AIDS and tuberculosis, and prevention of sexually transmitted diseases. And I'm very pleased that you here in the audience are supporting their efforts. I suppose the last thing I would say is we mustn't forget the men in the equation, but we also need some innovative approaches really to managing them and reducing their risks of acquisition and transmission. Anyway, thank you very much.
So we have Dr. Bobby John now to speak to us from India. And I forgot to mention, Results is involved in a separate project. It's called the Action Project. It's all around advocacy, particularly for tuberculosis. So our Results countries in Canada, the US, Japan, and the UK are working together to advocate within our countries for more funding for TB. And then we're working in India, Kenya, and Indonesia. Those three countries